What if I told you that a hip replacement surgery billed at over $116,000 ended up only costing $3,000? Today, we're going to dive into the real costs of hip replacement surgery when you're covered by an ACA Marketplace plan versus how Medicare would have handled this same thing. And this is all thanks to a viewer and subscriber of the channel who reached out and shared these costs with me. I will keep you anonymous, but I thank you, and the viewers of this video, I'm sure, will thank you as well. To help us with this project, we are busting out the trusty whiteboard. Now, the total billed amount came in at a whopping $116,603.39. Fortunately and unfortunately, our healthcare system's billing practices are all kinds of messed up, so this big, huge number gives us what we'll call our sticker price for this hip surgery. The official term is the billed cost. This happened in the greater Denver area, so I'm going to use costs from plans in that area as examples here. As with all of these videos, these costs are rounded for simplicity, and your costs will most likely be different because these plans and these costs will all depend on your zip code. This is just to show how all of this works. Okay, let's get into this. Our friend went in for 2 pre-op visits, seeing an orthopedic specialist as well as getting imaging in the form of an x-ray. The sticker price for the specialist visits came to $1,200, and the next amount that we need to look at is the allowed amount. This is the negotiated rates that the facilities and the physician have agreed to charge his insurance company. Insurance companies have different negotiated rates, as does Medicare. The allowed amount for these provider visits is $615, so just about a 50% discount off of the sticker price. Next, we move to how much the insurance company pays. And there are going to be words that we will use like deductibles, copays, coinsurance, and max out-of-pockets in this video. If you don't know what these are, no need to worry, I will explain those as they come up. And right off the bat, we learn that this individual plan has a $0 deductible. A deductible is the dollar amount that you need to pay first before your insurance coverage starts to pay anything at all. A $0 deductible plan is rare, but that's what our viewer has. If you are on a high deductible health plan that has, say, a $5,000 deductible as an example, you would pay all of the costs until the allowed amount reaches that deductible. In the made-up example, the $5,000. After you pay the deductible, then your insurance starts to help out at defined levels that will be dependent on the plan that you have. But our friend's plan has a $0 deductible, which means that insurance starts covering things immediately. Of the $615 allowed amount, remember that is 2 separate visits, insurance paid $595, and our friend paid a $10 copay for each doctor visit for a total of $20. Now, a copay is a fixed dollar amount. Like in this example, a specialist visit has a $10 copay. Every time you see a specialist, you pay this $10. In this case, where there were 2 visits, for $20 total. If you had 5 visits, it is that fixed $10 copay per visit for $50. So copays have super easy math. Okay, the next billed service was the charge for the x-ray imaging. The billed amount or sticker price is $200. The allowed amount or insurance negotiated amount is $100. Again, a 50% discount. Insurance paid all $100 in this instance, which likely means that the insurance plan has a $0 copay on imaging services in general, or it could be specific to x-rays. Different insurance plans will have different benefit structures around this charge, which I'll get to on the Medicare plan side. Now we move to the surgery itself. This hip replacement is an outpatient surgery. This means that they go in, have the surgery, and then leave without being officially admitted to stay in a hospital. In this example, they went in at 7 a.m., the surgery lasted 2 hours, putting them in the recovery room at about 9 a.m., and then they went home at 3 p.m. There are a lot of different itemized surgery costs that go into the numbers that I'm going to share here. Your explanation of benefits, or EOB, is something that the insurance companies send anytime you have healthcare services that breaks down what each part of these procedures would cost. To give you an example of some of the charges, we have the operating room costs, meaning there is a bill to use the operating room. There are lab costs, physical therapy costs while at the hospital or clinic, medications, anesthesiologist charges, the surgeon and physician's assistant have their charges, and there is the actual hardware itself of the new hip. The billed amount or the sticker price for all of these surgery costs is $109,000. Just as a fun fact, the hip implant part itself has a billed charge for $54,812.91. making up half of that total billed amount cost. New hip parts are expensive. And have you ever seen a $54,000 charge for a part? I leave secret code words in my video for comment management, and by letting me know your craziest bill in the comments, I'll know that you've made it at least to this point. Now, the allowed amount or insurance negotiated amount is $53,000. This continues our pattern of about a 50% discount. Of that, insurance paid $50,200. Now, for outpatient surgeries, our friend's plan has a 15% coinsurance. Remember, a copay is a fixed dollar amount, that $10 per visit as an example. A coinsurance is a percentage of the allowed or negotiated amount. 15% of $53,130 is about $8,000 that our friend would be responsible to pay. But our friend did not pay $8,000. He only paid $2,915, an effective coinsurance amount of only 5.5%. But why? Because with managed care plans like this individual plan through the ACA Marketplace, or like your employer plans, and something called a Medicare Advantage plan that we'll talk about here in a minute, we have what is called a maximum out-of-pocket, and this is often shortened to a funny-sounding acronym, MOOP. And in this case, the plan has a $3,000 maximum out-of-pocket. Any deductibles, copays, and coinsurance payments that you make out of your own pocket go towards this max out-of-pocket number. There were some prescription medications, physical therapy copays, and post-op coinsurance amounts that got our friend up to that $3,000 number. These bills all just came in at different times, and so that all kind of went towards that $3,000 number. So for this, and that surgery itself, they only paid $2,915 of that big $53,130 bill instead of the $8,000 that would represent their 15% coinsurance amount. With our friend's individual plan, drug costs are included in the max out-of-pocket. On Medicare, they are not. Medications in this example are minimal, and our friend only had to pay $13 in prescription drug copays or coinsurance amounts. So we aren't going to break down that in detail in this video, but that amount did go towards the MOOP on this individual plan. It would not go towards the medical MOOP on a Medicare Advantage plan or be covered by a supplement plan. But again, I'll get to that here in a minute. Okay, physical therapy started 3 weeks after the procedure with 1 visit per week for 10 weeks. The billed amount or the sticker price is $270 per visit. The allowed amount by the insurance company is $75 per visit. Insurance paid $65, and physical therapy visits are treated typically as a specialist copay, which we already know from earlier is $10 per visit until the max out-of-pocket is met. In this case, we'll put $65 here instead of $100 because the other $35 goes over to the insurance to cover since the max out-of-pocket is met. Something you'll want to note is that any monthly premium costs that you pay each month just to have your insurance plan do not count towards your max out-of-pocket. And this leads us to 3 other important costs that we need to include in this comparison. The first would be the monthly premiums for our friend just to have this insurance plan. This individual plan cost is $1,050 per month just for one person, not including a spouse. That is $12,600 per year. This plan is through the ACA Marketplace, which means there are potential subsidies, which would drop the monthly cost considerably. However, I get this question all the time, and I want to address it right here. In fact, I got this question today before recording this video. The question is, can I just keep my individual plan through the ACA Marketplace when I turn 65 and delay Medicare? Because with the subsidies, my plan is cheaper than what I would see on Medicare. Well, you can keep that plan. However, once you reach 65, you lose the ACA subsidies, and these plans become much more expensive than Medicare, as we'll see here in a minute. So the strategy of keeping the ACA plan is not what I would recommend. So since we're looking at comparing with Medicare options, let's now assume that you are eligible for Medicare. Our friend is approaching Medicare eligibility, but is not there quite yet, so their monthly premiums are considerably lower with the subsidies. If you are on an ACA plan and you are turning 65, it is probably time to move to Medicare. People will look at their costs with the subsidies and see that they are lower than Medicare, but those subsidies go away when you become Medicare eligible. The next costs that we need to add in are drug coverage, dental, and vision. Now, drug coverage is typically included with ACA plans. Dental and vision is not. Those are separate plans that you would need to purchase individually. And then drug coverage, dental, vision is included with one of these Medicare offerings, and they are not included with a different offering. So you'd have to purchase these as separate standalone plans with most of the Medicare offerings. Now we're just going to use averages here, but we're looking at about $45 per person per month for dental coverage, which would add $540 to the annual cost, and $20 per person per month for vision coverage, adding another $240 to the annual cost. I am trying my best to compare apples to apples, even though we are really comparing apples to oranges. So let's look at the totals here on the individual plan, and then we'll move on to how Medicare options would handle this. The total billed amount is $114,140 because of some rounding on these costs. The total allowed amount is $54,465, which is a 53% discount. The total amount insurance paid is $51,580, and then the total amount paid by our friends here on their individual plan is the $3,000 max out of pocket. But right here is where a lot of people go wrong in figuring out their total costs for healthcare, because remember, plan premiums do not go towards the max out of pocket. So it is $3,000 plus the monthly cost of the plan. In this case, the unsubsidized monthly premiums plus the dental and vision premiums, and we're going to look at the full 12 months, giving a total of $16,380 if they are not getting ACA subsidies. With subsidies, our friend's monthly premium is about $160 for one person, or just under $2,000 for the year, bringing the total to only about $5,700, an over $10,000 difference between pre-ACA coverage and 65 plus ACA coverage. So before 65, the ACA plans can be a solid option. Once you reach 65, not a great option. So here are the big takeaways so far for those trying to understand the healthcare billing system. Hospitals have absurd sticker prices. Insurance companies negotiate and pay a fraction of the billed charges, and then you, the patient, pay an even less amount thanks to your max out of pocket. But remember, your monthly cost to have insurance in the first place has to be factored in. Keep that in mind because it does make a big difference with Medicare. Speaking of, let's move to the Medicare side to see how that all stacks up. I'm going to start with the Medicare Advantage plan because it is the most similar to an individual plan in the way that it is structured. These are managed care plans with networks of hospitals and physicians that you would want to work within. Advantage plans have copays, coinsurance amounts, and maximum out-of-pocket costs. I'm going to use a pretty standard plan that's in our friend's zip code from the same insurance company that our friend uses for their individual plan. Please know that your options will likely be different, and these plans can vary dramatically. This is just an example. We'll use a plan that has a $0 deductible. Now we know what that word means. The plan also has a $5,000 max out of pocket because that is the average in this part of the country, and a $0 monthly premium plan because that is by far the most common. We have several challenges to address when comparing all of this, one of which is the allowed amount. Every insurance company has their own agreement in place with hospitals and providers. Even the same insurance company may have different agreements based on whether it's an individual plan compared to their Medicare Advantage plan, or maybe their commercial plan that is through employer groups. Medicare has its own allowed amount that is different and usually less than private insurance companies. I don't have those exact amounts for this procedure. I only have the individual plan's negotiated rates. I'm going to assume moving forward that the billed amounts and the allowed amounts are the same for the Advantage plans as well as original Medicare, but again, just know that they will not be the same for all of these. I just know somebody's going to comment on that. Okay, on the Advantage plan, the 2 pre-op specialist visits would have a specialist copay, similar to the individual plan. The plan that I looked at was $25 per visit for a total of $50. Copays are 2.5 times as much as the individual plan in this case. Next would be the imaging charge for the x-ray. Similar to the individual plan, many of the Advantage plans in this area have $0 copays for outpatient x-rays. Now we move to the surgery itself. On this Advantage plan, the outpatient surgery copay is $250. Our first significant difference. It is a copay, a fixed dollar amount with the Advantage plan, not the coinsurance, which was a percentage on the individual plan. Physical therapy had 10 total visits. On the Advantage plan, these visits are most often billed as specialist visits, which we already know are $25 copays on this plan for a total of $250 for all 10 visits. To even have a Medicare Advantage plan, you must also have Medicare Part A, which doesn't have a cost for 99% of people on Medicare, and you must also have Medicare Part B, which does have a monthly cost for most people. In 2025, the starting level is $185 per person per month for a total of $2,220 per year. This number goes up for those who have higher incomes. Here is the 2025 chart to show you the monthly premium cost based on your income and depending on whether you file your taxes individually or joint with a spouse. Pause here if you want to spend more time finding your number. Most Medicare Advantage plans include prescription drug coverage, which is Part D. They include some form of dental coverage and some form of vision coverage, all included in that typically $0 premium, which is another significant difference. The total costs for the Advantage plan converted into annual dollars would come out to be about $2,770 for the hip surgery and physical therapy and Medicare Part B premiums. We are nowhere near hitting the max out-of-pocket number because of that difference in having a copay for the surgery on the Advantage plan instead of a coinsurance percentage that we had on the individual plan. Now let's move to the idea of using just original Medicare only, no Advantage plan, no supplement plan, just original Medicare. I do get people who want to pursue this route, so we'll cover it. One advantage to original Medicare only is access to providers. With the ACA plan and the Advantage plans, there are provider networks that you are working within and that you need to be aware of. With original Medicare, you have access to any provider or facility in the country that participates with Medicare. That's approximately 97% of all non-pediatric physicians in the country. This is also an advantage that comes with having the supplement plans as well that are coming up. Original Medicare is made up of Part A, which is your hospital coverage, and Part B, which is your medical coverage. Since a hip surgery is an outpatient medical procedure, all costs here are Part B costs. Part B has a deductible, a word that we have learned. This year, it is $257, which in the grand scheme of things is a reasonable deductible, all things considered. You pay the first $257 before Medicare starts to help out. You meet this deductible with your pre-op visits, and that deductible is off of the Medicare allowed amount or the negotiated amount. It's not off of the billed amount. That's an important thing to differentiate and will help with your costs as you're planning for Medicare only. After the deductible is met, you have a 20% coinsurance for the rest of Part B costs with no max out of pocket. The first two pre-op visits will cost you a total of $329 combined with a deductible and a 20% coinsurance. The x-ray would be $20. The actual surgery itself, $10,600. A $15 charge per physical therapy visit brings it to $150 for all 10 visits. With original Medicare, you still have that monthly Part B premium of $185 or $2,220 for the year. Original Medicare does not cover prescription drugs, dental, or vision. If you want those coverages, you would purchase separate standalone plans. Using average costs, we're looking at about $45 a month for Part D or $540 for the year. Same averages for dental of $45 a month and $540 for the year. Vision is at $20 a month like earlier for an added $240 for the year. The total costs for original Medicare only come to $14,639. Less than an unsubsidized individual plan, more than an Advantage plan, and more than a subsidized ACA plan. Now we are going to cover some Medicare supplement plans, and these work quite a bit differently than the two managed care insurance plans that we've discussed with the ACA plan and the Advantage plans. Like an Advantage plan, you must have Medicare Part A and Part B to get a supplement plan. So we do still have that Part B monthly premium of $185 a month or $2,220 for the year. Where supplement plans are different is they have an additional monthly premium on top of Part B that you need to pay just to have the supplement plan. The national average for Plan G, which is the most popular supplement plan by far, is $160 per person per month or $1,920 for the year. Very similar costs in this area of Colorado as well, so we're going to use that. You could see much lower or much higher costs than this depending on where you live and the company you pick, as well as your age. Next, Plan G does not cover the Medicare Part B deductible, so you're still going to have that. Remember the deductible word that we've learned. This is the dollar amount that you need to pay first before Medicare starts to help. Again, the Part B deductible this year is $257, so the first $257 of the negotiated amount are your responsibility. You hit this after an x-ray and part of the initial consult with the specialist. So you are meeting your full deductible rather quickly. Now here's what's great with the Medicare Supplement Plan G, why it's so popular. After you pay the $257 deductible for Medicare Part B and your Supplement Plan G now take care of 100% of any Medicare approved Part B costs for the rest of the year. So from your cost sharing perspective, we are done when it comes to the cost for this procedure. You're just paying that Part B deductible. But here's where health insurance and Medicare get even more confusing and frustrating. When we looked at an individual plan through the Marketplace, it included prescription drug coverage both in the monthly premiums and as part of the max out-of-pocket, but it didn't include dental and vision. An Advantage plan includes prescription drug coverage, dental, and vision, all at no extra cost in that plan. But drug coverage and costs do not count towards the max out-of-pocket, and instead, Advantage plans have their own deductibles, copays, and coinsurance amounts, and a $2,000 max out-of-pocket on the drug plan specifically. Original Medicare only, as well as Original Medicare with a supplement plan of any letter, do not include prescription drug coverage either. They don't include dental, and they don't include vision. And so you would have to get standalone drug plans that also have their own separate deductibles, copays and coinsurance amounts, and a $2,000 max out-of-pocket here in 2025. This is all set to go up a little bit each year. In 2026, it'll be $2,100. This is why I said it's like comparing apples to oranges. These are all different ways to cover you and your healthcare costs, but we're trying our best to make it as close to the same discussion as possible. So we did add in the drug plan, the dental plan, and the vision plan cost to the supplement plan G using the same numbers we've been using for the others, bringing the total out-of-pocket costs in this example to $5,717 for the year. More than the Advantage plan, less than the unsubsidized individual plan, and less than Original Medicare only. Another popular supplement plan letter is Plan N instead of G. Plan G is by far the most popular right now, but Plan N is becoming more popular because it costs less. In Colorado, instead of $160 a month for Plan G, Plan N averages around $110 or $115 a month. Outside of this lower monthly cost, the way that this billing would be handled in this case of a hip replacement surgery with Plan N versus Plan G really doesn't have much of a difference. Plan N does not cover something called excess charges. This is more complicated than it should be, and I'll be quick, but there are 3 buckets of providers. Those that participate with Medicare, they agree to accept Medicare's payment schedule as full payment. Then there are those who do not participate with Medicare. They do not accept Medicare's payment schedule as full payment for their services, and they can charge up to 15% more. This 15% falls on you to pay if you are on a Plan N, and this is referred to as an excess charge. Plan N does not cover excess charges. Plan G does. The third bucket of providers would be those who have opted out of Medicare entirely. They do not bill Medicare, and you pay out of pocket whatever you and that provider negotiate. So for Plan N, it's that second bucket that is less advantageous for Plan N than Plan G. The third difference between Plan N and Plan G involves certain billing codes that are connected to certain doctor visits, where you could see an up to $20 copay or an up to $50 copay for emergency room visits on Plan N that you would not see on a Plan G. There are 19 billing codes that qualify for these copays, so it's not a lot of them, but they do exist, and that is a difference between Plan N and Plan G that you would need to consider. So outside of the differences of the monthly premium costs, excess charges, and those copays, Plan N and G will function the same way. In this example, the overall cost of Plan N would be less than Plan G, but more than the Advantage plan. Now, there is a high-deductible Plan G option out there that works a little bit differently, so we'll go over that. As the name implies, high-deductible Plan G has a higher deductible than regular G. Regular G has that $257 Part B deductible. Here in 2025, high-deductible Plan G is at $2,870. Using our hip replacement, you would be paying the first $2,870 that would include the pre-op visits, x-ray, and part of the surgery costs. After that, the high-deductible Plan G pays 100%. Since you are taking on more risk for the high deductible, the premiums are lower, looking at about $60 a month or an additional $720 a year. You still need to have Medicare Parts A and B to get these plans, including the Part B monthly premiums, and the high-deductible Plan G does not come with prescription drug coverage, dental, or vision, so we'll add those in here as well, using the same numbers as before. The total out-of-pocket for high-deductible Plan G in this example would be right around $7,130 for the year. Now, stopping this video right here is where so many people make 3 massive mistakes. I already pointed out one of them. I'll have people on an Advantage plan like this reach out and say, Advantage plans are superior. I only paid $250 for a hip replacement. Well, not really. You paid $2,770 for a hip replacement when you factor in the costs to have the coverage and the follow-up visits, and you are limited in which providers you can see to treat you with those networks. I'll have people on a supplement plan G reach out and say, I pay nothing for my healthcare outside of my $257 Part B deductible, and I can see any doctor that I want. Well, not really. You paid about $4,400 once you factor in your monthly premiums for that year. And that's not including prescription drug coverage, dental, or vision coverage if you want to have those. And it's not 100% of providers. It is close, but it's not any provider in the country. And what we're seeing as a problem, not just with Medicare supplement plans, but Advantage and all of these, is that more and more providers are opting not to participate with Medicare because Medicare continues to pay providers less and less money. And many of the providers that do participate with Medicare often have very limited availability to see new patients, which in some areas is causing long lead-up times to treatments that people want from these providers. This is a topic for another video, but the point is with either of these plan options, there are very real trade-offs that people are making between how much they want to pay in monthly costs with the freedom and flexibility and cost-sharing structures of these plans. Related to this is mistake number 2. This video is strictly looking at dollars and cents with one event, and there is a whole lot more to the story of Advantage versus supplement coverages. Do not make your Medicare decisions based on a single video or a single event. Supplement and Advantage plans work very differently from each other, and there is a video that looks like this that is arguably the best video that I've seen on the topic, and the presenter seems pretty handsome. This video was for 1 year. Most people are not on Medicare for just 1 year. I have a detailed video on the cost of each of these plans over the course of 20 years for you to go watch, and it looks like this. It also has a free spreadsheet that you can download that projects your costs out over those 20 years. You can put in your own numbers. The third and last mistake to avoid is thinking that everyone should think and feel like you. I am all too aware of the fact that people do not think or feel like I do on these topics. I do not care which plan you get. I am not one of the extremists that you will find here on YouTube or in the world who will tell you that everybody should get one of these or that everybody should get the other. Both work very differently for different people, and my job is not to force or persuade any of you into that line of thinking. Rather, it is to show you how these work, and then I think that you will feel in your heart of hearts what type appeals to you more. Unless you have something like cancer or multiple multi-day stays in the hospital or very expensive chronic diseases that require frequent hospital and medical costs, rarely will Advantage plans lose the cost comparison. They are just built differently, especially when you look at year over year of no premiums to have the plan when you are not having expensive issues. Some people love this, but remember, not everyone feels this way. Not everyone is worried about saving monthly premium costs, and they would rather have more flexibility with their healthcare decisions. Advantage plans are managed care. They are run by private insurance companies, and they replace original Medicare. They have networks of approved providers and facilities that you'll want to work within. These networks can change in the middle of the year. Advantage plans have prior authorizations where your doctors need the insurance company's approval to pay for certain procedures. Actually, in this example, our friend did have a prior authorization that was immediately approved, and they did not have issues with the insurance company covering this procedure. Prior authorizations are a heated topic for people. I have a video that looks like this that will go into more detail about prior authorizations, including looking at all prior authorizations over years for Medicare, not just anecdotal stories. Again, there may be trade-offs that you may be unwilling to explore with one plan, but someone else is unwilling to explore the alternative. We are almost done here. Before we leave each other, did you know that when you click the like button or that subscribe button, it tells YouTube that the information in this video matters and that it would help others? Also, don't forget to add in your craziest bill that you have seen in the comments so I know that you're part of the truly dedicated people who watched a good chunk of this video. If you want to show off your patience, leaving the word MOOP in the comments will let me know that you've made it all the way to the end. Please work with an independent agent who is licensed and familiar with the plans available to you. Even if it's not us, please use our competitors. Just use an agent to help you with these decisions. Compare the plans and costs, and then help you not just when you go on Medicare, but for the rest of your life if things change. If you do want our help, I have partners who can help with all 50 states, and you can contact me at theretirementnerds.com, or my email is in the description of this video. It is at this very moment that you have a choose your own adventure of sorts. Here is the video that goes over the Advantage versus supplement plan debate in more detail. Here is a video that goes over the truth about the prior authorization numbers in more detail. And here is the video that looks at the costs over 20 years with a free spreadsheet. I will let you choose where you go next. Regardless of your choice, I appreciate you watching, and I will see you over in one of these.